Hi, Dr. Huffman here from the Illinois Chiropractic Society Chicagoland Division. We're here visiting one of our Cook County doctors in downtown Chicago as part of our ongoing series of how doctors are dealing with coronavirus in their offices. While OSHA and CDC are providing great information, the Illinois Chiropractic Society is keeping us up to date with all the state and local changes as they're occurring. We can also learn a lot from what other doctors are doing in their offices. So today we're here in Lakeview visiting Dr. Douglas Krebs of Chicago Spine and Sport, and he's going to walk us through some of the things that have worked for him. So let's visit Dr. Krebs. Hello. What are some of the key things that you're doing in your office during these times?
CDC protocols are asking everybody to maintain 6 feet separation and wear masks. Being a chiropractic office, a physical medicine office, it's difficult to keep the 6 feet separation. But we are doing our best. That we are staying back from patients until we have to get closer to examine the patient up close. All patients are required when they walk in to have the mask on. Wear masks, be on time, because we are spacing appointments out so that we are reducing patient overflow and interaction. So we are running a tighter schedule than we did prior to the pandemic. For both, there is no crossing of patients in the office, and for maintaining a clean environment for them, as most of these disinfectants require 10 minutes of wet time on the table.
As we're socially distanced, can you tell us a little bit about what your patients' experiences are like?
So when a patient calls for the appointment, or once they schedule the appointment, our front desk reach out to ask them a series of questions such as, have they been in contact with somebody with coronavirus? Have they traveled outside the state? Have they traveled to areas of high coronavirus rates? And from there, schedule the patient to come in. Our front desk has been working from home since late March. So when they come in, our front door is locked. We'll unlock the door, take their temperature, and then from there, doctors lead them directly back to a treatment room.
And how is staff safety and rehab handled in your office?
When patients come into our office, we want first and foremost, we want them to feel comfortable. We want them to feel safe. We also want our staff and our doctors to feel safe. When a patient comes in, if it's a rehab appointment where we're going to be doing a decent amount of exercise, we have a large rehab area with 6 foot separators on the floor, just mainly tape on the floor, and we make sure that we keep the 6 feet distance as best we can.
Can you tell us just a little bit about telehealth and how that's working in your office?
Telehealth has been very valuable for us. This allows patients to feel comfortable at home, not having to leave their home, and also allows the patient to not have to travel to come see us in the office. It works very well for vast majority of cases. Via our website, we have the option for in-person or telehealth visits. They will get a link to a Google Meet appointment, and from there, the patient logs on from their home. There are some limitations to telehealth, such as missing subtle neurologic findings, and we're unable to take reflexes and the like. From there, the patient will, depending on the body part, if it's neck, we'll ask the patient to set up the camera in a way that we can see the neck. We'll run through range of motion exercises, asking questions, of course, after taking a history from the patient. Then we'll have the patient perform some movements, some therapies, and we see the response to care. McKenzie therapies, so we'll have them do repetitive motions and then reassess ranges of if we're able to help the patient this way. There are times that we need to get more imaging, that kind of stuff. This can all be taken care of via telehealth. There really hasn't been much limitation other than the times that as a doctor, you feel like you need to feel the muscles, see the joints in person. But for the most part, we've been able to take care of a vast majority of our patients. If they deem that they're high risk or they don't feel comfortable coming to the office, we offer the ability of telehealth for them.
Thank you, Dr. Krebs, and thank you all for watching. And stay tuned for our next in our series on coronavirus in the healthcare setting. Until then, stay healthy and safe.